Alright, be honest. When you hear appointment with a dentist, your brain goes straight to that chair, that light, and that sound, right? But what if I told you most people have no idea what actually happens, step by step? And some of it might completely change how you feel about going. Today, Dr. Esma is here to break it down in a way no one ever has. Not the boring version, the real version.
You're right, Rasim. Most patients walk in expecting discomfort or uncertainty, but an appointment with a dentist is actually very structured, very controlled, and often surprisingly comfortable. The interesting part is what happens before any tools even come out. That's where everything starts.
Wait, so the real story begins before you even sit down? That's exactly what people never talk about. Stick with us, because what happens in those first few minutes can completely change your entire experience. Let's be real for a second. Most people don't walk into an appointment with a dentist feeling relaxed. You're thinking, is it going to hurt? Did I wait too long? Are they about to find something unexpected? And then there's that awkward moment sitting in the waiting room, hearing distant sounds and imagining the worst-case scenario in your head.
Exactly, Rasim. Many patients arrive with stress already building, often based on past experiences or simply fear of the unknown. The truth is that tension starts even before the appointment with a dentist begins, and it can shape how the entire visit feels from start to finish.
And that's the crazy part, right? Nothing has actually happened yet, but your brain is already running a full movie. So the real question is, what's actually happening behind the scenes while you're sitting there waiting? So this isn't just about comfort, right? Because if you walk into an appointment with a dentist already tense, everything feels worse. Even a simple check suddenly feels like a big deal, but if you understand what's actually happening, it's like flipping a switch in your head.
Exactly, Rasim. When patients understand the flow of an appointment with a dentist, they become more cooperative, more relaxed, and outcomes actually improve. For example, a calm patient allows us to perform a more accurate examination, which means better decisions and fewer surprises later on.
So it's not just about feeling better, it actually affects the result. That's wild, which means those first moments we talked about earlier are way more important than people think. Okay, Dr. Esma, give us something real. Like, how often do you actually see this fear play out during an appointment with a dentist? Because I feel like almost everyone has at least one bad memory.
Honestly, Rasim, it is very common. A large number of patients come in already expecting discomfort, even if their last appointment with a dentist was years ago. I had a patient recently who delayed visits for over 5 years just because of anxiety, and when they finally came in, the process was far easier than they imagined.
That is crazy. So the fear builds up over time, but the reality is often much simpler. Which means people are stressing over something that might not even happen the way they think. Alright, Dr. Esma, let's go a bit deeper. From a science perspective, what's actually happening in the body during an appointment with a dentist? Because clearly, it's not just in your head.
Great question, Rasim. When someone anticipates an appointment with a dentist, the brain can trigger a mild stress response, releasing hormones like cortisol. This can increase heart rate, muscle tension, and sensitivity. But here's the key part. Once the patient feels safe and understands the process, those levels drop quickly and the body relaxes.
So your body is basically reacting to a story it's telling itself, not the actual situation. That explains why two people can have the same appointment with a dentist, but completely different experiences. Alright, this is the part everyone's been waiting for. Walk us through it, Dr. Esma, step by step, what actually happens during an appointment with a dentist from the moment you're called in.
Oh, of course, Rasim. First, we greet the patient and review their history briefly. Then comes a visual examination, checking teeth, gums, and overall oral health. If needed, we take digital scans or x-rays. After that, we explain everything clearly before doing any procedure. Nothing happens without the patient understanding it first.
So it's not jump in and then start drilling like people imagine. It's actually step by step with communication the whole way. That already sounds way less intimidating. Okay, this is where people usually mess things up. Dr. Esma, what should someone absolutely do and definitely avoid before and during an appointment with a dentist?
Great question, Rasim. First, do not skip basic hygiene before your appointment with the dentist. Clean teeth help us examine more accurately. Also, be honest about your symptoms and habits. What you should not do is hide pain or delay mentioning concerns. That can lead to bigger issues later.
So no pretending everything is fine just to get out faster. Got it. Anything else people overlook?
Yes, always communicate. If you feel discomfort, raise your hand. An appointment with a dentist should always be a two-way process, not something you silently endure.